Welcome back to the channel. It is your favorite ER technician, steveioe, with another video. Today, we're gonna talk about what happens when you are having a bad day and you come to the ER for thoughts of hurting yourself, also known as SI, suicidal ideations.
Let's get started.
In a perfect world, we would have psychiatric facilities all around for you to go to look for help, but that doesn't exist. So what you can do is come to the emergency room and we will make sure you are medically okay and safe until you can get to one of these facilities. When you come to the ER for thoughts of hurting yourself, the first thing that's gonna happen is you will check in with someone from registration. They will get you a neat little wristband, ask you for all your personal information, and then you officially become a patient of the ER. Someone like me, the ER technician, will come, ask you what's going on, get your vitals, blood pressure, pulse, oxygen saturation, temperature, respirations. Once you tell me that you are having thoughts of hurting yourself, we will bring you back into the ER, out of the waiting room. We kind of want to get you out of there as soon as possible because we don't want you in the waiting room unsupervised with everybody else around you. If you come to the ER for thoughts of hurting yourself, your first team will be the ER team. We will make sure you are medically cleared and you don't have any physical emergencies while you wait for your psych team. Once you come to the ER for thoughts of hurting yourself, we will get you on an 8-hour medical hold. That time is used to make sure that you are safe until the psychiatric team can come talk to you. Just think about it, okay? The ER's job is emergencies. If you come in for a car accident, your arm falls off and you're bleeding out, we're gonna make sure your arm stops bleeding and you're alive with a pulse before you go to surgery so they can fix up that arm, stitch it up, and then get you out of surgery to the ICU. Same thing with psych issues. We are not there to fix the problem. We are there to make sure nothing emergent happens to you, and then you go upstairs or to a different facility where the professionals who specialize in psych will get you help. Don't be surprised if we put you in the hallway for a few reasons. The ER is busy. We typically like to save the private rooms for patients who need very private exams. It's much easier to keep an eye on you if you're in the hallway. Also, don't be surprised if you get put into a chair. ER is busy. Once you get back into the ER, we will get you changed out of all of your clothes. This includes the bras for the women, but you get to keep your underwear. We'll bring you to a bathroom. Probably not gonna let you go unsupervised in the bathroom, but somebody will help you change out of your clothes into a hospital gown and hospital socks. Ta-da! They will not always be bright yellow. These are great. There's grips, so you don't trip and fall on the slippery hospital floors. Once you change out of all of your clothes, we will also now be documenting all of your belongings. In the hospitals, we use clear plastic bags, so we know what you have at a glance, kind of like going to a rave. You come in with plastic bags so security knows if you have anything that can harm people. This bag includes all of your belongings, clothes, phone, wallet, keys, jewelry, all in here, all very well documented. Now, the last few places I've worked, we will take your phone away because you're not allowed to have it, but if you want to use your phone, you can ask somebody there, say, hey, I want to make a phone call. They'll get your phone for you and they'll let you use it supervised. All your stuff will then be put into a locker or somewhere in the ER for safekeeping. Once we have all of your stuff documented and it's away, we will get you a sitter. This person is specifically someone who is just going to sit there with you to make sure you don't harm yourself or run away.
I'm watching you, Wazowski.
While you are waiting for your psych team, you will have a sitter, either a security guard or a nursing assistant or a medical assistant, or if we're really short-staffed, the nurse who's sitting behind the charge desk will occasionally look up to make sure you're okay. You also are not allowed to do anything by yourself anymore. So if you want to go to the bathroom, we won't be inside the bathroom with you, but I will put my foot at the door so it doesn't close and maybe just listen to what you're doing. I will try not to peek. This is all to keep you safe. And sitters do multiple things. They don't just watch psych patients and make sure they're okay. They watch confused patients, patients with dementia and Alzheimer's, to stop them from getting out of bed or to stop them from pulling out their IVs. They watch patients who have hit their head and are a little confused and don't know where they're at. So lots of reasons for sitters. One of the reasons to watch psych patients. You get situated, you have a sitter, you're in your gown, your stuff is documented, you wait for the ER doctor to come talk to you. He's gonna make sure if you did hurt yourself, lacerations, you did end up swallowing some poison, we're gonna make sure all that is good and you're alive and well, get you some fluids if you're dehydrated, and then you're gonna wait for the psychiatric team. It's also important to note that the ER team can also give you medications to keep you calm while you wait for the psych team to come talk to you if you need it. Yeah, you know, if you come in and you're like, hey, I'm having a really hard time, like, you know, we got all kinds of medications to keep you cool. You know, little Ativan, little Seroquel for the depressions, you know, all that good stuff. The psych team will come down. They will talk to you. And if they think that you need extra psychiatric help, they will put you on a 72-hour hold and they will transfer you to a psych facility. So the 8-hour medical hold can be shortened. Again, if they come down and deem that you, listen, they're just having a bad day, a bad hour, they're okay now, you will be able to go home with resources and information for you to follow up. If they believe that it is more important for you to stay and get further help, they will put you on a 72-hour hold and then they will start working on placement. Where can you go to get the right help? Usually a psych facility, or if you're lucky, your hospital will have a psych unit upstairs and you will get transferred upstairs. I would love to warn all of you, if you come to the ER for psych issues, there is a good chance you're going to be waiting in the ER until a bed opens up. Fair warning, okay? Again, that is because there's been a huge increase in psych patients and our psychiatric providers and resources have not caught up yet. They're getting there, which is why you are now going to be stuck in the ER for a little bit as we try to sort things out and figure out where to put you. But remember, it's always better that you actually went to the ER and got help rather than sitting at home alone with these thoughts by yourself. It sucks in the ER, but at least you're doing something to help yourself. So don't kill yourself. If you think about it, just turn it off.
I'm kidding.
So again, don't shoot the messenger. We are just doing our best. We were not meant for psych patients. There should be psych facilities for you to go to. I believe in that. Don't come to us. No. Not don't come to us. Thanks for watching. If you have any more questions about SI or coming into the ER for thoughts of hurting yourself, comment below, ask your questions, and I will do my best to answer them. But the important thing is, if you are not having thoughts of hurting yourself and you feel like you are okay, you can come to my comedy show. Ticket link and dates are in my bio. I am on tour from now for the rest of the year, so I hope to see you there. Goodbye, motherfuckers. Welcome. That's wind, right? CPR. Get him, mouth to mouth. Tips from the ER. Suicide.
Thoughts of hurting yourself.
Thoughts of hurting yourself. You get checked in. You talk to someone. Damn it. So once we get you back out of the way, it's much easier to watch you if you're in the hallway for other people, you know, to watch you. So security knows if you have anything that can harm people. I was gonna say gun. I feel like this is not the appropriate time. In case you have a gun, you wanna hurt somebody. As in you're not having any medical emergencies that, you know, could potentially, I wanna say end your life. Has it been clear that you can, that people come to the ER for SI and that you can?
Yeah.